Okay, Houston, we've had a problem here.
This is Houston. Say again, please.
Yes, Houston, we've had a problem.
All right, it's time to fix COVID-19 policy. Let's start by looking at the problem. First of all, we need to recognize that people are dying of COVID-19. This is a serious illness. Unfortunately, whenever government policies are issued around COVID-19, what we've also found is that they say that they're making their decisions based upon science and based upon data, but unfortunately, we're noticing that science itself has been politicized. We're seeing that fear, not data, is actually driving the policy decisions. As a result, businesses are closing, many of them permanently. We've got jobs being lost, which means people are losing their ability to take care of their family. We've got education at risk for our next generation of leaders. And the basic premise of our bedrock of our society, our election system, is at risk as well. And ultimately, the very rule of law is at risk. That kind of frames the problem. Now let's provide some closer look into some of the data behind the problem and hopefully help us identify different solutions that work and evaluate those solutions so we can figure out the best solution is. So first of all, we need to recognize that over 156,000 people have died already in the United States. But we also need to go in and look at the fact that 93% of these deaths occurred in individuals that were 55 years or older. We also need to understand that only 6% of these deaths feature patients that had no other comorbidities. In other words, they had no other life-threatening illnesses. The key data throughout all this discussion, when we talk about data-driven policies, are the following three parameters: infection rate, the hospitalization rate, and the infection fatality rate. And I want to clarify too, the infection rate is not the same thing as a case rate. You can be infected but not be a case because you may be asymptomatic or you may simply never have gotten the test. And there's some other complications that go into that as well. But the infection rate is the actual number of people who have been affected as a percentage of the population. Hospitalization rate is very important because it goes off and addresses the core tenet that a lot of people have been talking about of flattening the curve. Well, that flattening the curve means we don't want to overtax our healthcare system so we can still treat other individuals of other illnesses, etc., and still leave capacity to treat all those who need treatment. So hospitalization rate is used to determine whether or not we're overtaxing the capacity of our system. And then the last data rate is that of the infection fatality rate, and that's actually also referred to a lot of times as a mortality rate. That's not the same thing as a case fatality rate. What we want to do is base it upon the number of people who are infected, and so please be on guard that that's not the same thing. So infection rate, not case rate, is a key data point. The hospitalization rate is a key data point, and also the infection death rate. Now we've had data fidelity issues associated with this. Part of the issues that deal with testing itself. So there's three basic forms of tests. Two are diagnostic in nature. The other is more trying to determine what the prevalence of the disease is in society. So the first two are antigen-based tests. It's a quick test that can be performed in minutes. Unfortunately, it's got a false negative rate on the order of 40 to 50%. The next one, which is a gold standard, is the PCR test, so polymerized chain reaction test. This actually looks at genetic material, or looks for genetic material associated with the virus in the subject, and that's supposed to be the gold standard associated with this. When it comes to the antibody tests, that's what you can use to determine whether or not there's evidence that the disease is currently or has been in that subject, and that gives you a better idea of how far that virus has spread in the community. What we've unfortunately found with the result of a lot of the testing that's come back is that some of these tests We already talked about the risk of false positive. There's margins of error associated with some of these tests that need to be addressed. But also we're seeing some weird things coming out of lab results where 100% of samples coming from certain labs with certain exams are actually showing that everybody is positive. Matter of fact, the PCR test itself and the gold standard version of it, which is the RT-PCR test, can show a significant number of false positives because all it's really looking for is that fragment of the of DNA of the virus. And COVID-19 is actually one instance of a family of viruses known as coronaviruses. So you could find fragments of that pretty easily. Matter of fact, even the common cold can register it as a potential false positive if you ever had that recently. So there are significant issues associated with the fidelity of data that we're getting. And another key thing that everybody needs to understand is that there are effective treatments out there already. We've seen positive results coming out of hydroxychloroquine with Z-Pak and also with zinc. We've also seen positive results regarding nebulizer treatments and steroids, and even some folks more holistic medicine background are promoting vitamins. There's also promising drugs on the market like remdesivir, and also, of course, people are looking for vaccines around how to prevent this in the first place from folks. So there are a lot of opportunities to go off and treat this, and we're seeing that in the prolonged decrease of death rates as we go forward in the with this COVID-19 crisis. Unfortunately, a lot of the good news stories I found are getting suppressed out in the media. As a matter of fact, it's very difficult digging for a lot of information that I found because you will get some false flags up there from media outlets that will highlight something as where some bureaucratic fact checker that's not a doctor is actually seeking to suppress testimony provided by doctors. We've got, as we go forward here, I want to make sure that we understand when I've gone off and looked at all the different science and scientific data that is out there, I found no evidence of a safe gathering size. So a lot of the government policies that are restricting the size of gatherings, please understand there is no such thing as a safe gathering size that's been specified. Also, there's no evidence that masks work, and this gets into a debate over model-based predictions versus trial-based predictions. In models, it looks like masks would be very, very effective. But when you actually look at trial-based studies, especially those done in the wake of the SARS outbreak a few years back, there is absolutely no evidence that masks actually work. Also, there is something, though, that is there is evidence on that's very significant, is that there is significant evidence that lockdowns do not work. When you actually look at what is communities where lockdowns have been promoted versus communities where there were no lockdowns, what you're seeing is that they have not decreased the death tally at all in those respective communities when you do the lockdown. There's just no evidence supporting it. If you look at what's happening in my home state of Michigan, for example, there's over 6,000 deaths in the state of Michigan, and we're a population just south of around 10 million people. When you look over in Sweden, their latest death rate, and their population is over 10 million. Their latest death rate is around 1,000 people less than what we saw in Michigan. And they kept everything open in Sweden. They kept their businesses open. They kept their schools open. Let's look closer to home, out in South Dakota. We've got a case where I think roughly around 100,000, the population of South Dakota is only about just south of 900,000. So it's about an order of magnitude less than that of Michigan. But if you look at the per capita death rate in my home state of Michigan, which did lock down, you'll see a per capita death rate of 0.06%. When you look at South Dakota, which did not lock down, it kept all their businesses open, kept their schools open, their per capita death rate was 0.01%. So there is significant evidence that lockdowns do not work. And just to amplify that just a little bit, what they've noticed in New York was that 66% of the COVID patients that they received were those people that were staying at home with family members in a lockdown situation. So clearly, lockdowns do not work. So what should our objectives be around any COVID-19 policy that come forward? Now, first of all, I think we can all agree that we need to minimize fatalities. Next, we need to make sure that we're driving the decisions via data, not just in rhetoric, but in actuality. We need to restore the rule of law. The Constitution doesn't disappear when you have an epidemic. It's something that if you have a case to make as an elected official and it violates for a policy decision that violates the Constitution, make the case for it. You do not have the force of law to support it, so you got to make your case to the American people as to why that's a course of action we should pursue. Also, hopefully we all agree that we need to restore the economy. We need to get people their jobs back and their ability to go off and take care of their families. We need to resume education, and we need to restore an appreciation for scientific integrity, because there's been a lot of lapses in scientific integrity that appear to be based on political motivations. Most recently, the Lancet study that came out and blasted hydroxychloroquine only to have it further peer-reviewed and retracted very shortly afterwards. But the timing of its release was designed to mitigate the promise and hope associated with promising treatment like hydroxychloroquine, but the retraction did not get nearly as much press as the initial study did. And I think hopefully a lot of us will agree we need to get back to normal life. So those are the basic objectives. They don't all have the same weights associated with them, but the next step is going to be identifying solutions. And when we identify the solutions, what we're going to be doing is evaluating each one of these solutions against these objectives. And I want to point out, I put in solutions that are all across the spectrum. They're solutions that I don't necessarily agree with, but I want to make sure we're being fair and truly data-driven when we go off and do our evaluations of the different solutions. So I'm going to put out stuff that I don't necessarily agree with, but I want to put them out there so we do the evaluations in accordance with the objectives. We're going to rate them all in accordance with how they achieve the objectives. So here we go. There's 4 basic categories of solutions that I've seen available, and they correspond to which group can actively implement that solution. So the first group is personal behavior. That's what individuals can go off and implement. It lists all the different solutions that individuals can implement. The next is healthcare. That's where the healthcare industry lists all the solutions that the healthcare industry can take. Science lists all the different solutions that science industry can go off and take on. And then, of course, there's solutions that governing authorities can pursue as well. All right, let's start off by looking at personal behavior. As it turned out, Mom and Dad were right. Good hygiene works. Wash your hands, cover your mouth when you sneeze, and you're less likely to go off and spread the disease. Also, because only 6% of the COVID-19 deaths dealt with people with zero comorbidities, the idea is that you want to stay in good physical health. And so there's no substitute for staying in good physical shape. The other thing we can go off and do, rather than quarantine the healthy, is self-quarantine if you're sick. If you've got symptoms around COVID-19, you can't smell, you got a fever, you're having difficulty breathing, by all means, self-quarantine. One other option that's been promoted in a lot of different policies, you can wear a face mask. Please understand, though, that the evidence does not suggest that the face mask will protect you from getting the disease. There is some model-based evidence, though, that would suggest that by wearing a face mask, it would protect others from getting the disease. By the way, the same study would also go off and support the idea that if I cover my mouth when I sneeze, I'll have the same effect. Another policy that's been promoted is you can self-limit the number of the size of your public gatherings, and for some people this is serious because it affects weddings, it affects funerals, things that we normally take for granted would be large gatherings. A lot of people are self-selecting on the size of these gatherings. And the other thing we can go off and do is avoid high-risk behavior. So you don't want to, for example, if you are in a high-risk demographic, you're 55 years or older, and you probably shouldn't go where there's a lot of people or a lot of evidence that there's COVID-19 positive individuals in that area. All right, so let's look into the science area. Number one, we need to improve that test data, not just the accuracy of the individual test, but we need to standardize upon the most accurate tests so that when we see this data being presented, we can do apples-to-apples comparisons. Which gets to the next part, which is we shouldn't be hiding any of this information. We should be making it available to the general public. If our government officials are basing their decisions based on this data, then we need to be able to have access to that data as well. Also, we need to improve the peer review process, make sure that it can happen quickly in times of crises like COVID-19. We can't wait for 2 years to have another study to come out. We need to be able to objectively look at different studies and be able to provide good substantive evaluations of them in a much more expedited time frame. We need to promote herd immunity therapeutic treatments. We are identified. There are some that are showing quite a bit of good promise on that front, like hydroxychloroquine. We also need to investigate the development of vaccines. That has worked in the past for different things, but we need to also understand that, and even the CDC recognizes that vaccines are only effective 40 to 50% of the time. Also, when it comes to science, we need to promote an appreciation for trial-based studies over model-based studies. It was model-based studies that gave us the initial projection of 2.2 million deaths in the United States, when in order of fact, we've only experienced, thank God, on the order of around 156,000 deaths. So let's look at healthcare. What can the healthcare industry do in regards to solutions? Well, improve their testing and related patient management practices is one thing. You don't co-locate COVID-19 positive patients with non-COVID-19 patients. A lot of that deals with how fast are you getting your test results. And if you do a presumptive positive on everybody, you run the risk of putting non-COVID-19 patients in with COVID-19 patients, and thereby risking that they would contract the disease inside your hospital setting is supposed to be protecting them. Also, one option is to restrict elective procedures, so you're only seeing COVID-19 patients. Well, that's one way of approaching it. You can promote prophylactic treatments, so preventive treatments. For example, hydroxychloroquine was given to our military personnel in Vietnam to prevent contraction of malaria. It's been proven safe for use for over 65 years. That is one option you can go off and pursue. You can allow physicians to treat symptoms early. A lot of hospital systems will have defined protocols that restrain the application of certain drugs to their patients. If we allow doctors to approach how to treat each individual patient on a case-by-case basis, we can have a better healthcare result. And also, we need to prepare for the next crisis. We should have no discussion over PPE shortages or ventilator shortages or anything like that if we're properly prepared. All right, what can government do? Well, one of the things that government has done is issue stay-at-home orders. They've required mandatory face mask wearing. They've implemented practices like contact tracing. They've implemented mandatory vaccinations, or they've hinted that they're going to be doing mandatory vaccinations. The other thing that government could do is actually simply respect the Constitution and the rule of law. They can protect vulnerable populations instead of putting them at risk. They can promote data transparency and help discourage censorship. They can restrict which businesses can remain open, which can't. That's the essential versus non-essential discussion. Should the government be in the business of doing that or not? We evaluate that as a potential solution. Also, government's gone off and promoted the idea of closing schools. And if they do close the schools, well, maybe some schools want to remain open. Government could also promote school choice to allow parents the option of where to send their kids so that they feel their kids would be most safe, or address other needs that they need to pursue. The other thing they can do is restrict prescription authority of physicians. A lot of states, including my own home state, threaten physicians who prescribed hydroxychloroquine to their patients to treat COVID-19 with the removal of their licenses. So that is one option they can pursue. The other option is to remove prescription restrictions for safe drugs like hydroxychloroquine. Also, we talked a lot about, especially early on in the crisis, about flattening the curve. Well, one of the reasons we're worried about overtaxing our healthcare system is that government has implemented via policies called certificate of need laws. It was government limiting hospitals to the number of beds and other critical medical equipment that they could have as a means of reducing competition and inflating the price of our healthcare. So one thing we could do in response and preparing for the next crisis is to repeal these onerous certificate of need laws. And then last but not least is that if we see any government official that is not respecting the rule of law, one option that we all have is to go off and lead impeachment or recall efforts for unlawful government officials. Impeachment is a legislative-led activity that starts with the House of Representatives in most governments, state governments around the country. Recall is an initiative that's typically reserved for the citizens. But the bottom line is If we want to respect the rule of law, one way of doing that is to hold those who break the law accountable. That about wraps up all the different possible solutions that I've identified. You may have more. This is called Build 1.0 for a reason. If you have additional solutions that you'd like to have considered, send them our way and we'll put them into the mix. When it all rolls down, we've gone off and done some detailed analysis where we've looked at all these solutions against the objectives. And what we've come up with is that the top 3 solutions overall are, number 1, if we want to achieve all those objectives to the best effect possible, is we need to protect our vulnerable populations. That means we don't co-locate COVID-19 patients with are in nursing homes, which is a horrible practice that a lot of governors have actually done here in the United States, including in my home state of Michigan. We need to remove prescription authorities for restrictions for safe drugs like hydroxychloroquine. We need to allow physicians to treat symptoms early. Essentially, we need to get out of the middle of the doctor-patient relationship. All right, when it comes down to what can individuals do, number 1, self-quarantine if you're sick. Don't go into work. Don't go into large gatherings. Stay at home if you are sick. Getting good physical fitness, and then practice good hygiene. Wash your hands. Remember, was it 2 Mississippi, 3 Mississippi? Sing happy birthday to yourself when you're washing your hands. When it comes to science, we need to promote herd immunity, which recognize the fact that most people are going to get infected with this, and if you do that, make sure we get infected at a rate that is such that we can essentially inoculate our communities from spread of the disease. Next, we need to promote therapeutic treatments, and we also need to investigate the development of vaccines. The healthcare industry, what we need to do is make sure we allow doctors to treat patients as they see fit and treat those symptoms early. We need to promote prophylactic treatments. We need to improve testing and related patient management practices. And when it comes to governance, top 3 things that we can do is protect vulnerable populations, which means don't co-locate COVID-19 with elderly. Also, we need to remove those prescription restrictions, and also we also need to take seriously the need to respect constitutional rights and the rule of law. So that's my roll-up on a quick version of the COVID-19 policy solutions. As always, if you want to see all the detailed analyses and detailed data behind each one of these, go from our media version into instead our engineered version, and you can find that by becoming a member of the Right Stuff Club, and you'll see that out at letsfixstuff.org via the Right Stuff Club. So thank you guys very much for your attention on it. COVID-19 policy issue is a very serious issue, and I hope you'll take these solutions to heart and share them with your friends and family.